Ketamine should be used for folks who have treatment-resistant depression, who've had chronic depression, generally 6 months or longer, and who have tried other things, whether that be antidepressants or therapy, and they just haven't noticed an improvement in their symptoms. So ketamine's not for everyone.
Sarah Tetko is a physician assistant in the Chapel Hill area who leads patients in various forms of therapy, including the 2019 FDA-approved treatment of ketamine nasal spray.
Ketamine works in its own way, right? Like we might go into a session with that, talking about eating and food behavior as the intention for the session, but we might end up talking about the passing of someone's grandparents, and then that reveals itself as the root cause of this need for control and where their anxiety and depression stems from.
For patients like Shayna Dudak, ketamine therapy has been life-changing.
Something like me literally picking apart my face until it's bloody. And that was like one of my biggest things was when my anxiety was through the roof. It got to the point where my lips were so sore and they would crack and they would bleed. It was embarrassing and it stopped. Like there was no denying that. And that is something I've battled with since I was a kid.
Dudak is a patient of Dr. Bryant S. Edwards, an anesthesiologist and former military nurse who runs a ketamine intravenous infusion clinic near Fort Bragg, North Carolina.
And the studies say what we're 70 to 80% effective as treatment-resistant major depressive disorder. Anecdotally, I believe that to be true. I've seen this in my clinic, okay?
Patients can find a local ketamine clinic within seconds, but with minimal FDA approval and insurance coverage, actual access is limited.
Sometimes we have eaten costs. Sometimes we've given people real big breaks on treatment. If somebody's benefiting from it, but they can't afford it, sometimes we've absorbed the cost of that treatment just to help people.
Tetko, Edwards, and Dudak hope to open conversation around new unconventional treatments like ketamine therapy in order to open up access for those who need it the most.
My mother had her own set of problems with drugs and alcohol. And so I grew up with a lot of that back when people didn't understand really that at all. There's a lot more options out there for me now and a lot more understanding. And hopefully I can be part of that for my daughter's generation.
In North Carolina, I'm Julia Fairchild Roth reporting.